enough and does a poor job supervising them. Clouds will bring some light rain and snow to the state later today. Slightly warmer air too. Highs will reach the 20s and 30s in most of Maine. Tonight, precipitation will turn to snow, accumulating 2 to 4 inches in northernmost Maine, 3 to 6 inches in an area from Howland and Springfield in central Penobscot County, northward to Holton and eastward to Hancock and Washington counties. Tomorrow, partly or mostly sunny skies.
I'm Jennifer Rooks, and this is Maine Calling. COVID cases are on the decline, but there is still a lot of confusion about mask guidance, a new variant, and frankly, what comes next. Today, Dr. Nirav Shah returns to the program to answer our questions about all of that and more. Of course, Dr. Shah is director of Maine's Center for Disease Control and Prevention. Thank you for joining us again, Dr. Shah.
Well, good morning, Jennifer, and good morning, everybody. It's great to see everyone and be with you all today.
We invite all of you to join the conversation, share your comments and questions by email. A brief email, please, talk@mainepublic.org. Post a comment on Twitter, Facebook, or Instagram, or give us a call, 1-800-399-3566. Again, 1-800-399-3566. Dr. Shah, we'll start with the latest. What are the latest numbers that you're tracking, and what do they tell us on this Tuesday morning?
Well, Jennifer, as you noted, things are improving. We've all endured a period where we had the Delta surge last year, followed quickly by the Omicron surge, which brought the highest numbers of cases, the highest numbers of hospitalizations, and sadly, some of the deadliest weeks in the pandemic that we've seen. Since then, since just the past 4 or 5, 6 weeks, Omicron is in recession. And we see that in virtually every number that we look at across the state of Maine. When it comes to COVID, things are improving, and that is a very good thing. Let me just provide a couple of numbers. Right now, as of this morning, there are 158 people hospitalized in Maine with COVID-19, 44 in the ICU and 9 on ventilators. Now, that's still a sizable number of folks, but it's a fraction of what we saw 2 weeks, let alone 1 month ago. We see the same thing when we take a look at, for example, wastewater testing. When we started our large-scale wastewater testing program across the state of Maine, working with municipalities, we initially saw very high levels of the virus all across the state. But in the ensuing weeks, as we've continued to test, what we've seen consistently across the state is that the virus is in recession. Not everywhere and not at the same degree. But overall, the trends are that COVID is starting to recede. That's a very, very, very good thing. We still are not out of it, though. We're still going to be talking about things, as I'm sure we will today, like masking. We're still going to talk about things like the need to get people boosted if you haven't been yet. I want to talk with folks about ways to be treated if you happen to get COVID. And of course, talking about how we're going to live with COVID-19 going forward.
You know, Dr. Shah, I want to ask you about the big national news last week and how Maine fits into that. The CDC on the federal level announces that 70% of people in the country probably don't have to mask indoors anymore. And there's a big map that comes out, and boy, everywhere, but it looks like Maine is on that map. And it's hard, I think, for a lot of us to get our heads around, because Maine, we have a really high vaccination rate, and we're hearing about how well everything's going. So how come we aren't in that? How come 13 of 16 Maine counties are still considered high transmission and don't count and are not part of this federal guideline?
Sure thing, Jennifer. Well, the first thing to start when we think about these newest federal CDC guidelines is about what they're really telling us. What question are they answering? The previous guidelines, the ones that these updated, were really about how much transmission is going on out there. How many new cases are there? What's the positivity rate? And as we've talked about, as I've noted, things like cases and positivity rates don't really provide accurate assessments of what's going on in the pandemic. These newest guidelines shift from community transmission to community burden. Not so much how much COVID is out there, but what impact is it having on everyone's lives, as well as the impact it's having on the healthcare system. And to do that, it relies much less on things like transmission rates and much more on things like hospitalization rates, what's going on in hospitals. And what we see when we take a look at what's happening in Maine and why the map looks the way it does are two things. The first is that we still have cases happening in Maine. Several hundred people per day continue to get diagnosed with COVID. Even though our overall vaccination rate is amongst the highest in the nation, it's not uniform across the state. More uniformity in vaccinations, and particularly in boosters, would help keep those case numbers low and drive them lower. The other is that hospitalizations are a factor. They are the prime factor in driving what appears on that map. And Maine, because of our older than average population, has tended to have some hospitalizations, or been having hospitalizations at a rate higher than some of our neighbors, for example. Some of that is all a part of what's happening right now. The third is that we still have a few thousand cases left in our backlog that we have to clear out. Now, these new guidelines really focus on hospitalizations, not so much cases, but the new case count is one of the gates that you have to go through in order to figure out what color you're going to land at. So that continues to play a part. All of these things all get to the bigger question that I'm sure we're going to talk about, which is, what does it all mean when it comes to masking?
I'll ask that then. What does it all mean when it comes to masking?
That's there's no question about it. I'm in favor of the CDC shift from guidelines focused on community transmission to community burden. However, I get that the one thing that people want a simple answer to is the very binary question, should I wear a mask? And here's the thing, Jennifer, everyone wants a one-size-fits-all answer, but we have to remember that not everyone is the same size. I wish I could give you and everyone listening an answer that would apply to everybody in every situation. But the fact is, everyone's got a different risk profile. And we sometimes use the word risk and people get frightened. But risk is not something to be frightened of. It's something to be assessed and managed. And COVID is becoming much more like other diseases and risks that each of us have to manage based on our own health backgrounds. If you've got diabetes, you've got to manage your carb and sugar intake. If you've got asthma, you've got to be careful when you go out for a run to make sure you've got your inhaler. If you've got high blood pressure, you've got to watch how much salt you take in because of the medical consequences. COVID now enters that realm. If you are somebody who has lung disease, you need to wear a mask. If you or a family member has recently had an organ transplant, you need to wear a mask when you're around them. If you're a relative or you're caring for a relative who's got cancer, it's prudent to wear a mask. The new CDC guidelines are the first step in answering the question, should I wear a mask? And if you're in a county where the color is not one where the US CDC recommends wearing a mask, that's the first step of the equation. But then you've got to ask yourself these other questions. What is my own risk? What is the risk to people around me? What is the risk to my loved ones? And that is really where the work is going to get done. The CDC guidelines are the first step. They set the bare minimum, but we should all aspire to something a little bit more than just the bare minimum.
Speaking of masking, school vacation week is over. That was last week for most of Maine. Many schools already changing their masking guidance. Dr. Shah, many are looking to you, waiting to hear if you are going to change your masking guidance for Maine schools. What do you have to say to school boards and superintendents today?
Well, I've been I've continued my conversations with superintendents around where we stand there. And let me start by just noting that here in Maine, there is no statewide school mask requirement. Those decisions are made where they ought to be made, which is at the district level. And we've continued to offer them our support. Now, right now, as of this moment, we recommend masking in schools. However, things are improving. The improvements I talked about right at the top, Jennifer, are not unique to the schools are experiencing the same improvements as are the rest of the states. We're seeing reductions in the number of students who are testing positive, reductions in the number of outbreaks that are happening at schools, reductions all across the board. These are very positive. What I'm looking for right now are two things. The first is stability. These trends are encouraging and they point us in a direction where Maine CDC may be able to back off on recommending masks, but maybe moving it to something different than a recommendation. So we're looking for stability in those trends. The second thing we're looking at is what this newest CDC guidance tells us. It is, again, but one part of a broader picture here, but it's an instructive part because it tells us what's going on and what that risk might mean and translate to as it comes to schools. As you noted, we're coming off of the vacation week. Those types of events have often taken kids who have traveled to places across the country with their families, potentially been exposed, and then thrown them all back into a school together. My team and I are going to be taking a look at the data around outbreaks and absenteeism later this week and early next week to see what we see. And if we continue to see stability in those trends, as well as coupled with the encouraging data we're continuing to see from wastewater and from the new CDC tracker, well, these would be signs that we can move away from the recommendation, which where we currently stand, to something different. This is a scientific process. I don't want to be hasty. The fact is, when it comes to things like masking or social distancing throughout the pandemic, what I fear is that we've been a bit too late to recommend them as a country and a bit too hasty to move away from them. So I understand that there's a lot of enthusiasm around moving away from this. I hear that, and I want to make sure that we're being responsive. I also want to make sure that we're moving at the right pace to be protective and make sure that we don't cause a situation that gets worse.
Yesterday, the announcement was made that there's that new variant was indeed found in Maine, the BA2 variant. The announcement made yesterday, Dr. Shah, when do we think it actually came into Maine, and how many cases are there, and how many do you expect there to be? And sort of, I understand this is quite transmissible. Is this going to be something that quickly becomes the dominant strain of COVID-19 in Maine?
Well, that's the open question right now, and I'll definitely get back to that and what we know about this new variant. But let's start about what we know about this new variant. It's called BA2, and it is part of the Omicron family of viruses. It's not distinct. It doesn't have a Greek letter of its own. It's part of the broader family of the Omicron strain. However, it is thought to be more contagious than the Omicron that we've known thus far in Maine. Although it does not appear, based on some early papers, to be that much more severe, but it's still severe. Again, when we talk about mild, we always want to talk about milder than what? It's still something that has to be reckoned with, especially if it's more contagious. Now, we've identified 2 instances of the BA2 strain here in Maine. Are there more? Undoubtedly so. There's no question that there are more because we only sample a subsegment of all of the positives across the state of Maine. And there will be more because it is more contagious. The question is, what does this mean for all of you? First, let's talk about what it means for folks who are fully vaccinated and boosted. I want to go back to the booster piece because getting boosted is really essential right now. The more we learn about COVID vaccines, the more we learn that the boosters are not a separate thing. They're really part of the series. And if you are fully boosted, the likelihood of catching BA2, it's a little bit higher than it was before, but it's not out of the realm of something to be really, really concerned about. You should still continue to take precautions, especially if you've got one of those medical conditions that we talked about a moment earlier. The real question that's on a lot of folks' mind is this something that is going to return us to the picture we saw in mid-January with hospitals under significant stress and strain? And there have been some countries where that has occurred, like Denmark, and more recently right now, Hong Kong. But those are countries that are slightly different. They didn't experience the giant tsunami of Omicron that most of the United States did. BA2 is going to continue to grow because that's what viruses do. But it's the question of whether will overtake the current Omicron and cause another tsunami. Epidemiologists I've talked to are concerned about that, but they're not necessarily betting that it'll happen.
All right. Dr. Shah, I know you wanted to talk about some of the therapies that are emerging and how widespread is their use? How effective are they? If somebody does come down with COVID-19, what can I expect? How will I be treated?
You're absolutely right, Jennifer. Thank you. This is something I wanted to talk with folks in Maine about today. One of the things that's much different now as compared to a year, let alone 2 years ago, is the availability of various therapies, drugs, that will help take care of you if you get COVID-19. Some of them are infused by an IV. Some of them are what we call monoclonal antibodies, but 2 of them now are actually pills that you take. They range in effectiveness anywhere from 30 to 50%, all the way up to 90+%. And when we really zero in on the things that really matter, that we really focus on, like keeping you out of the hospital and keeping you alive, all of these drugs do an exceptional job. We've got a lot of them in Maine, and I want folks to be using them. And one of the ways in which folks use them is to signal to their healthcare provider that they have COVID and that they need them. Now, we've placed them at places across the state of Maine, whether it's at the pharmacy for one of the oral pills or at various healthcare facilities, hospitals and others for the ones that you have to get by an IV. Here's what I'd like to ask everyone to do as it relates to therapeutics. I'd like everyone to have a plan for how they will go about accessing these drugs if they get COVID. And I want to talk about what that means. The first thing is that I'd like everybody to have an ability to get tested at home if you get symptoms. Tests are literally freely available, either through the federal government or through a program that the Mills administration set up. You can order these tests and they will be shipped directly to you. So the first thing I'd like to ask everyone to do is to have a plan to test yourself. The second is have a plan to connect with your healthcare provider. If you self-diagnose yourself with COVID, a way to get in touch with your doctor to make sure that if you test positive, you can call your doctor's office and say, I just tested positive for COVID. Here's a picture of my result. I am at risk because I've got diseases X, Y, and Z, and I'd like to figure out how to get these pills. Now, your doctor will have to evaluate which one of these therapies is best for you. Maybe it's a pill, maybe it's an IV. If you don't have a doctor, which I know a lot of folks in Maine don't, now is a good time to find out how. Federally qualified health centers, for example, across the state of Maine are an option if you're struggling to find healthcare. Now is the time to prepare to figure out how you will get these drugs if you test positive for COVID. That preparedness is essential because these drugs are the most effective when they're given within the first few days of you getting symptoms. The goal is to keep you out of the hospital, and we do that by getting you treated as early as possible.
So don't wait.
Don't wait. Don't wait. The drugs are available. We have them in the state. We'd like folks to be using them even more than they are now.
All right. Dr. Nirav Shah is our guest today on Maine Calling. We are going to take a quick break. Your comments, your questions when we come back. This is Maine Calling.
Listener support brings us Maine Calling with help from Quarry Hill and Camden, committed to offering gracious living options for adults 55 and better. Learn more at quarryhill.org. By Eastern Basements, a division of Maine-owned Eastern Mold Remediation, offering basement waterproofing solutions. EasternBasements.com. And by the State Theater, presenting Leon Bridges and Little Dragon, August 14th at Thompson's Point. Tickets on sale at statetheaterportland.com.
On the next Speaking in Maine, join Associate Professor of African Studies and Radical Feminist Judith Castleberry as she discusses churchwomen within the Black Pentecostal Church.
I'm highlighting the confluence of emotional, intimate, and aesthetic labor by churchwomen as they carry out care work.
That's coming up on the next Speaking in Maine, Tuesday afternoon at 2 on Maine Public Radio.
Maine Public is pleased to be a media sponsor of the Bangor Symphony Orchestra's Masterworks 4, From Firebird to the Future. Join conductor Lucas Richmond and the BSO on Sunday afternoon, March 6th at the Collins Center for the Arts in Orono as they perform Stravinsky's iconic Firebird Suite and the world premiere by composer Jessica Mayer. Maine Public members are eligible for 15% off tickets for this concert. For details, please visit mainepublic.org and click on Events.
And welcome back. This is Maine Calling. Today, our guest, Dr. Nirav Shah. He is the director of the CDC here in Maine. We are talking about the latest pandemic developments and getting answers to your questions about masks, booster shots, COVID tests, and other concerns. You can ask those questions by email, talk@mainepublic.org. You can comment on Facebook or Twitter or Instagram, or give us a call at 1-800-399-3566. Dr. Shah, a few questions are related to something we were talking about in the first section. So I'll go to this tweet from Matt, but many people have a similar question. Matt asks, new CDC guidance classifies all but 3 Maine counties as high risk. Is that being skewed by Maine's case backlog, or is that an accurate assessment?
It's largely an accurate assessment. Most of the determination that goes into assigning a county a color is based on their hospitalization rates, as well as how many new people have been hospitalized, as well as how many beds within that hospital have been occupied by a COVID patient. And that's really what goes into assigning a county to the green, yellow, or red categories. However, the guidelines also divide counties into 2 groups. Those who have had more than 200 cases per 100,000 in the past 7 days, and those that have had fewer than 200. And the math goes one direction if you're in one group and a little bit differently if you're in the other tier. Now, we still have a few cases in our backlog that we're plowing through, nothing like what we had anywhere near like a week or 2 ago. And so that might be skewing things a little bit. However, when we take a look at the number of new cases that are coming in every single day still in Maine, they're still at a fairly high level. So for a while here, there might be a little bit of a skewing because of that backlog, but we anticipate that it would be very short-lived. In any event, it's the hospitalizations and what's going on in hospitals that are doing the bulk of the work there.
I'm not asking you to predict, but based on the trends you're seeing, do you expect Maine to continue to be an outlier here?
I don't think it will. And I don't even know that it's really an outlier. When you take a look across northern New England, there are some urban areas like around Boston that are quite low. They're quite green because there are so many folks there and so many hospital beds. Areas where there are fewer hospital beds, or regions of the country where there are fewer hospital beds, might continue to see higher colors because even a few people being hospitalized can introduce volatility. In a small county with a few number of people, even a handful of new hospitalizations means that the rate of hospitalizations goes up, and the other metric, how many beds are being occupied out of the total beds, looks a lot worse. So there is this bias here where smaller counties may, or less urban parts of the country, may look a little bit redder than others, but that is a function of the way that the entire metric was built. Now, keep in mind, this metric is designed to be applied nationally, from Fairbanks to Fort Kent. It is one metric for the entire country, but it is not the only metric. It is not designed to be the only metric. It's designed to work in partnership, in conjunction with other public health metrics, for example, like wastewater testing and vaccination rates. If you're really looking to get a holistic picture of what's going on in your community, in your neighborhood, well, in your county, we'll say, you should partly be looking at this map, but I'd also urge you to take a hybrid approach and look not just at this new map, but also, for example, wastewater testing in your area, vaccination rates in your area. All of these things will be helpful in painting a much more robust picture of what's really going on in your neck of the woods.
All right. We'll go to Cal, who's calling from Appleton. Hi, Cal. Go ahead.
Hi, Dr. Shah. I'm wondering, how can we seriously expect to manage Omicron and BA2, as you've been talking about today, when only 41% or so of all Mainers and less than 30% of all Americans have actually had a booster shot?
Well, it's a great question, Cal, but I think it's important to start with where those data really are. Our booster rates in Maine are actually some of the highest in the country, and that puts us in very good stead. So let's just start with that, because boosters are really, really, really critical. I can't underscore that enough. The more we learn about vaccines and COVID vaccines, the more we really, really, really realize that the Pfizer and Moderna vaccines are really 3 doses, not 2. And the J&J vaccine is really at least 2 doses, not just 1. So the boosters should not be thought of as separate. They are part of the initial series, and they are often what's doing the big work there. But let's talk about the percentages. Here in Maine, I think you indicated that it was in the 40s. It's actually 54%, 53.7% of everyone who's fully vaccinated in Maine who has been boosted. Now, I wish that number were higher. It does put us among the highest boosted states in the country. But the other thing I'd like to ask everyone to do, in addition to having a plan to get therapeutics if you get COVID, is to go get boosted. If you're listening right now and you've been vaccinated, but you haven't gotten your booster, I'd like to urge you to do so. I gather that a lot of people have said, you know what, I'm done. I got my vaccine. I don't want to go back, but the booster is essential. And the boosters will be part of the way that we will be able to deal with these new variants, whether it's BA2 or whatever may be coming down the pike after that.
All right. You gave us the numbers on the booster. Dr. Shah, how about the original vaccine? What was the percentage of adults in Maine who have gotten the original vaccination? Do you know that off the top of your head?
I do. 78.3% of every single person in Maine, no matter their age.
Adults.
Not just adults. 73% of everyone from day one all the way to the oldest person in Maine, 78.3% of Mainers are fully vaccinated. That is an astounding number. Again, it puts us among the most highest vaccinated states in the country, arguably one of the more vaccinated places on the planet. It's an astounding,
so if you take out,
figure.
For example, children under 5 who are not allowed to be vaccinated, the rate's even higher.
It's even higher. I'd like that rate to be more uniform because we have pockets of unvaccinated, and I'd like all 78.3% of those folks to get their booster. But my hat goes off to Mainers, right? This was not easy. Making this happen over the course of the past 13 months was an immense, immense lift between Maine people, healthcare workers, you name it, we got it done. It's pretty impressive.
Thanks, Cal, for your question. We'll move to Portland and Will. Hi, Will. Go ahead.
Hey, thanks for taking my question, Dr. Shah and Jennifer. So with the lower hospitalization rates, one of the things I've noticed is the CDC's also reported what seems like a record number of deaths in February. From what I can see, 296 deaths, and 41% of those being fully vaccinated based on your breakthrough reports. And so I'm just kind of wondering, with those really high numbers of deaths, how does that contribute to your reported lower hospitalizations?
Yeah, that's a great pickup, Will, a good catch. We've been actually looking at that on our end as well. The other note I will add onto what you've observed, Will, is that increasingly more and more of the deaths that we report are not reported to us by hospitals or by doctors, but rather deaths that we find because we look through our death certificates from time to time to make sure we have a truly complete picture of what's going on. When you hear me talk about our vital records review, that's what I'm talking about. In the recent 2 months, more and more of the deaths that we've recorded have come not because the person passed away in a hospital or a nursing home, but because they perhaps passed away at home and their attending physician knew that they had COVID and put COVID down on the death certificate as a contributing cause of death. And that's how we've found an increasing number of deaths lately. It suggests that fewer people are passing away, it suggests that more people are dying at home rather than, say, in a congregate living setting or at a hospital. What we're looking at is what that means. Is it that people are not seeking care when they're sick? That's a concern. Is it that they weren't being offered therapeutics like monoclonal antibodies or the oral medications? That's a concern. But you're right, we have seen more of those, partly because we take the extra step to make sure our data are complete. But we also want to understand what the epidemiological significance, the public health story behind this is, because if it's a problem that we can address, if we can make sure that people who are really ill are not waiting it out at home, if we can make sure that they're getting medications so they don't die, we want to do that. I mean, our goal, my team's goal, is to keep people alive, to keep them out of the hospital. And these new therapeutics help us do that.
Well, thanks for your question. We'll move up to Southwest Harbor and Barbara. Hi, Barbara. Go ahead.
Hi, thank you for taking my call, and thank you, Dr. Shah, for everything you've done for the state of Maine. Appreciate it. I'm calling about tests, and that seems still to be very evasive here in the state of Maine. Back in September, my husband was going to travel, and he needed to get a test, a PCR test, and he had to go all the way up to Bangor. And then when he came home, he had to go down to Belfast for another test. And then recently he's traveled again, and he was unable to find any kind of test of any kind. But when he got to the state where he was going, there were 3 drive-through PCR-free testing sites. Why isn't Maine on the ball with that?
That's a good question, Barbara, for a couple of reasons. The first is that what we found is that people strongly, greatly prefer testing in their own home. We, in fact, did have a number of testing sites that were up and active throughout the month of January into mid-February. And we actually brought some of those offline because we were only seeing a small handful, maybe fewer than a dozen people per day. What we found when we talked to people was that their preference was to test at home. And that's why one of the reasons why we moved toward a program where people in Maine, across the state of Maine now, can order a test from the state of Maine's website through a partner rather that we use. I'll make sure I tweet about it a little bit later today, but it's a group that we work with that offers COVID tests just for Mainers. We're working with another organization, the Rockefeller Foundation, to make this happen. This is on top of the tests that are available, for example, for free from the US government. Tests are also more widely available for at-home use in places like pharmacies. Now, there's still a need for PCR testing. There's no question about that. And that's why many locations across the state continue to offer them. For example, a number of pharmacies across the state will still offer PCR testing. However, those needs have largely been eclipsed by those who prefer to have at-home testing done. And given the accuracy, the speed, the privacy, and the convenience of at-home tests, we think that's going to be the direction for most people most of the time.
Barbara, thanks for your question. We'll move on to Augusta and John. Hi, John. Go ahead.
Good morning, Dr. Shah. I have a question. For those of us of a certain age or a certain risk category, we got our initial vaccines almost a year ago and our booster almost 6 months ago. Is there any talk of or need for us to be thinking about an additional booster anytime soon?
Thank you for that question, Sarah. The answer is, first of all, I'm so glad that you got your vaccines early on. And I'm so glad that you got your booster. There is a lot of discussion and research underway right now to determine whether folks as you say, folks of a certain age might need to get another booster shot. Right now, here's where that discussion is. Although there are some studies that have suggested that a second booster, a 4th shot, might help some folks increase their level of immunity, the latest data don't suggest that they will necessarily help you avoid infections or hospitalizations. However, Sarah, I want to just be really clear. There's a lot of research that's still underway right now to help us better answer this question. What I just said just now is not going to be the last word on this topic, sir. It's going to continue to evolve as scientists do more research into whether a second booster is needed, and then how much better off are you if you get that second booster? There's a good chance that as we go throughout 2022 and maybe even into 2023, some categories of individuals may need to get a second booster. Maybe it will be by age. Maybe it will be if you have certain health conditions. A lot of that is under research right now. At this time, there's not an indication for folks in your group to go out and get a second booster, but that is something that is being studied and may change.
All right. Well, we do need to take another quick break. We're speaking with Maine CDC Director Dr. Nirav Shah. We'll be right back.
Listener support brings us Maine Calling with help from the Maine Souvenir Shop, committed to supporting Maine artists and designers. Exchange Street in Portland, Instagram, and MaineSouvenirShop.com. By Taproot Magazine, an independent publication and market in Portland, committed to inspiring makers, doers, and dreamers. Learn more at taprootmag.com. And by Evergreen Home Performance, a locally owned energy efficiency company with career opportunities available. Details at evergreenyourhome.com.
I'm Peter O'Dowd. President Biden delivers his first State of the Union address this week, and he does so with a war raging in Europe, inflation at a 40-year high, a pandemic stretching into its third year. The president's message to the country and the latest from the ground in Ukraine. That's next time on Here and Now.
Stay with us. Here and Now upcoming shortly at 12 noon today here on Maine Public Radio. You have a passion for public media and enjoy working outdoors? Maine Public is hiring. We're seeking a full-time broadcast transmission technician to join our team and help maintain our broadcasting equipment and transmitter facilities. Based out of Bangor, this position will frequently travel to our facilities in Maine's northern counties. Complete details and application information is available at mainepublic.org/careers, and the deadline to apply is March 6th.
Welcome back. I'm Jennifer Rooks. You're listening to Maine Calling. With me today, Maine CDC Director Nirav Shah. Join our conversation if you're quick. 1-800-399-3566. Send a brief email to talk@mainepublic.org, or you can find us on Twitter, Facebook, or Instagram. We will go to Brian, who's calling from Washington. Hi, Brian. Go ahead.
Yeah. Hi, Dr. Shah. It's really nice to talk with you. I'll try to make it quick. Would it be fair to say that the people that are currently still being ventilated or in the hospitals are still, particularly the ventilated people, had the Delta variant, and that the Omicron variant really isn't bringing people into the intensive care unit like Delta? I understand that the alveoli in the lungs are not being so much attacked as they were with the initial variant and the Delta variant. And I also understand that Omicron offers a significant amount of protection. Now, I've had the booster shot, I've had all that, and I would follow CDC guidelines, but I'm getting the impression that the Omicron variant, for some that are healthy, isn't a bad thing to get in that regard. Also, the one other question that has to do with aspiration with injections. I agree with aspiration because of the rare chance of being have the vaccine placed into a vessel.
Yep. So let me start. I'm glad you raised this. So let's start with what's just going on with Omicron, because you're right, and I promised Jennifer that I would try to keep my answer short, but I'm physically incapable of doing that. So Omicron, it is thought to be milder than Delta, but when we say words like milder, we've got to always ask ourselves, milder compared to what? Milder for whom? So on and so forth. Folks who are on a ventilator right now are almost certain to have the Omicron variant. Even though, again, it might be milder than Delta, it is still a severe disease. And you're right, even though it does tend to infect the upper airways a little bit more than the lower airways, it can still affect the lower airways, particularly if somebody already has lung disease or so on and so forth. So it's almost certainly the case that everyone on a ventilator, and perhaps everyone in the ICU right now, has been afflicted by the Omicron variant rather than the Delta variant, which pretty much disappeared from view when Delta came onto the scene. All of that suggests that COVID is not something to be trifled with. You're right. Some folks who are healthy may endure a bout with Omicron and be just fine. And indeed, I've even seen on social media that some folks are pursuing that with the strategy, just getting COVID and getting it out of the way. But you need not do that. We have a vaccine. And I know you said you were vaccinated and boosted, so I'm not preaching to you, but we have a vaccine. It's always struck me as a little bit odd that people would pursue a strategy of getting a disease in order to avoid getting a disease in the future. The best thing to do to avoid that entire thing is just to get vaccinated.
Brian, thanks so much for your question. I'm going to go to an email from Sarah. Sarah asks, have they seen any breakthrough COVID-19 cases in children under 12?
Breakthrough cases of COVID in children under 12. I suspect that they have occurred. I can't pinpoint an exact one in Maine, although it's likely they have occurred. But my guess is also that the frequency of such occurrences is lower. That group just became able to get vaccinated not long ago. And so the waning immunity that can sometimes happen in some individuals probably has not yet set in. I don't want to say it hasn't happened. It may have, but it has not happened in significant numbers as to register quite yet. But it is something that we are on the lookout for.
All right. An email here from Wayne. Some elderly folks may not be able to physically self-test for COVID at home. What alternatives should they pursue?
The best alternative for folks in that situation is, again, to be prepared, because you're right, not everyone may be able to utilize a self-test. You have to be able to swab your nose and then stick the Q-tip into the card. It's not difficult, but it may be not something it may not be something.
Sure. And the packaging is hard to deal with.
Yeah, it's hard to open them up and everything. So there is an alternative, which is at-home saliva tests. They are a bit pricier. I'm not going to avoid that. They are pricier, but it is possible to have the at-home saliva test such that if you don't feel well, you can use that and then send it off. You put it into an envelope, usually a FedEx, some type of package, and you speed it off somewhere and you get a result that way. So that is an option. And that one doesn't necessarily require fiddling with all of that. However, we've also heard for some elderly folks, being able to produce enough saliva is not easy either. So it's definitely a challenge. I don't want to glide over that for 1 second. It's not easy. I think about these things when I think about my elderly relatives as well. But what I've helped them do is to try to make sure they have a variety of tests available. Some of them are rapid antigen tests. Some of them are saliva tests, but they've got different tests available. So no matter how they're feeling, they can try to access something.
Dr. Shah, is there any kind of traveling nurse program or traveling healthcare worker program where someone could come to a home and do a test if someone is concerned?
We don't have anything of that sort online right now, largely because home tests are a great option for many, many people. So we don't right now have that, but that's a good idea. It's something we could certainly look at.
We'll go to Ryan, who's calling from Thomaston. Hi, Ryan, go ahead.
Hi, thank you very much. For a pleasure talking to you both. My wife and I are self-employed. She's able to stay home. With
Ryan, can you get any closer to your phone?
Oh, sorry about that. Is that any better?
I think so. Go ahead.
My wife and I are self-employed, and we have a 3-year-old daughter. So we've been able to maintain a zero COVID policy. We're not in contact with anybody else for 2 years now. No birthdays, no holidays, no families. My question is, in April, if it comes back from the study that they're doing on child vaccines that is still not effective for people under 5 years old, do we give up then and just go back to life, or do we continue to hold out hope and still be careful?
Man, Ryan, I hear you. I wish, I can hear the uncertainty and the anguish in your voice, man. I hear what you're saying. I wish that I had something helpful to offer you today. So let me walk folks through what Ryan's talking about. On Valentine's Day, or right around then, February 15th, the FDA pushed pause on their work to vet and authorize the Pfizer vaccine for kids 6 months up to age 5, Ryan's child being in that category. And they did that not because it was unsafe, but because they wanted to finish up the studies using 3 doses rather than 2 doses. Kind of what I was saying about earlier. These are really 3-dose vaccines. And Ryan is saying, what happens if the 3-dose study doesn't get us to where we need to be? Ryan, I'm not sure what the answer is going to be there. My hypothesis, if that happens, big if, is that what they'll do is probably do another study, but with a higher dose of the vaccine. There's been a lot of research lately about what the right dose of the vaccine in kids needs to be, and some concern that it might not be as high as it ought to be. So if that were to happen, big if, Ryan, my hunch is that they'll go back, do another study, but at a higher dose, and hopefully get us over the finish line. But keep
Dr.
hope
Shah,
alive, man. Keep hope
a
alive.
lot of questions about how the CDC is doing this. Just today, editorial in the FDA challenging the statistical models being used. The very basis for how this is being looked at.
Yeah, it was a bold move by the FDA to push pause. There were a lot of folks on both sides that thought this was the completely wrong call, which is probably good evidence that it was a close judgment call. I think FDA got this one right, but I acknowledge that it was a gut punch to a lot of parents who were expecting their kids to be fully vaccinated by March or April, only to learn that they won't even probably get their first shots until the end of April. No question about it. It was a gut punch, but this is science in action. Science is not something where there are bright lines and easy answers. It's often messy, and we're seeing it unfold in real time. Usually these discussions never even make it to the newspaper, let alone the front page. But now it's something that we all witness in real time. But that's the science doing a good job at being safe and effective.
Thanks for your question, Ryan. We'll move on to Portland and Richard. Hi, Richard. Go ahead.
Hi, this is Richard from Portland. And I was just saying, calling to say, why should we trust you when you're funded by George Soros and you mishandled the Illinois drinking water situation?
Okay, Richard, you did not ask the question you told our producer we're going to ask. So I'm going to move along. I'm going to go to Ellery, who's
actually,
calling
Jennifer,
from Waterville.
I'll
Okay,
answer
go
that.
ahead.
I mean, Richard's just wrong on his facts. I'm not funded by George Soros. I've never been funded by George Soros. I'm paid for I am an employee of the state of Maine and no one else. And in terms of why you should trust me, you should ask hard questions. Everyone should ask hard questions. If you're looking for whether I've been dedicated to the state of Maine, if you're looking for whether I've cared for the people in the state of Maine, if you're looking to see whether I've made the state of Maine my home and have worked tirelessly with my staff to do nothing other than to keep us safe from COVID, all you need to do is to look at what my team and I have done over the past 2 years.
Ellery in Waterville, go ahead.
Yes, thank you, Dr. Shah, for this excellent work. I appreciate the pharmacology and the psychology of vaccinating and masking, but I'm concerned about perceptions. And I help several people who are in their 70s, 80s with their shopping and groceries and whatnot. Now, I have to make sure that their perceptions are that I'm doing the right thing to be safe for me and for them. So I'm wondering, stats won't help, statistics won't help.
Yeah.
Are there any other tools in the toolbox for helping with people's perceptions that people are doing the right thing to be safe?
Ellery, you and I have talked before, Ellery. I recall your name from prior Maine calling, so it is a pleasure to chat with you again, sir. You are spot on. I completely concur with everything you said. We are at a point in the pandemic where numbers and facts are not what moves people. Indeed, if numbers and facts ever were what moved people. Ellery, I think it comes down to two things. I think number one, it comes down to trust. Reference the prior caller's question. And I've said this before, and I get hackles when I say it, but it's true. When people trust you, the facts and science don't matter. And when people don't trust you, then the facts and the science don't matter. It comes down to first establishing a base of trust. And that comes from knowing the facts, but not necessarily leading with the facts. Right? No one's going to be convinced by the high school debater who is just trying to spew a litany of facts and statistics. No one's convinced by that. What I think is more effective are a few things. The first is honest conversation with folks. We sometimes glide over some of the concerns that people have with vaccines rather than addressing them straight on. The other are stories. Narratives matter. If you know somebody who perhaps would have had a negative outcome but for the vaccine, that is really compelling. If you know somebody who did have a negative outcome because of COVID and says, I should have gotten vaccinated, that's the sort of story that will be helpful. That's where we are in the pandemic. I think it's not about spewing facts. It's more about understanding people's concerns and being responsive to them. That's one reason Jennifer and I have taken time to chat with folks throughout these programs who have those concerns.
Valerie, thanks so much for your call. An email here from Margot. My friend cannot taste or smell a year after she had a mild case of COVID. How much risk do we have for getting long COVID?
The risk of long COVID, I'm glad that this was brought up because I myself have been remiss in not talking about long COVID enough. And I'm not the only one. I think public health and healthcare in the United States needs to do a better job of acknowledging the challenges that many people have. Rates of long COVID vary depending on what study you look at and what population you're looking at, but they may be as high as a fifth, so 1 in every 5, or some studies, maybe even 1 in every 3 people have certain degrees of lingering symptoms based on how you define long COVID. One of those is not getting your sense of smell back. That's a concern. It has happened. In many individuals, they may temporarily lose their sense of smell, but not permanently. But for some, it is something that's longstanding. Others have longstanding fatigue and longstanding shortness of breath. There's a lot of research being done on long COVID to understand who's susceptible to it and what might turn it around. But it is a risk. And sometimes when I hear folks say, I don't need to worry about COVID, I'll be fine. I wouldn't need a ventilator. Maybe not. But what about all these symptoms of long COVID? Would you really truly be immune to all of them? And are you willing to take that risk?
So, Dr. Shah, we have less than a minute left. And if I'm summing up what I think I'm hearing you say this hour is get your booster, but also if you think you have symptoms, test. And if you do test positive, call your doctor right away. Don't wait.
Don't wait, and have a plan to do all of those things. We're at a period now where COVID is somewhat in recession. It's a good time to move away from the emergency mindset that many of us had and have a plan in place to get your booster and what to do at home if you get symptoms, because therapies are available. We have them. We really want people to use them because our job is to keep Mainers healthy.
And what if you test positive and you have mild symptoms? Should you still call your doctor?
If you have mild symptoms, in all likelihood, you're going to be okay. However, mild symptoms can turn very quickly into severe symptoms. If you're someone who's at higher risk because you've got a lung condition or a number of other things that put you at higher risk, it's a good idea to call your doctor so that if you start feeling worse, then you're ready to go. The best time to treat is before things get worse. So your doctor may say, let's treat you now, even though your symptoms are mild, and that is the right thing to do.
All right. Well, thank you so much for joining us. As always, Nirav Shah, Director of the Maine CDC. Today's sound engineer was George Thomas, and we had additional help from Nick Godfrey and Nick Woodward. Maine Calling is produced by Cindy Hahn and Jonathan Smith. Don't forget to go to mainecalling.org and sign up for our new weekly newsletter. Tomorrow on the program, we are discussing the outlook for solar energy in Maine. I'm Jennifer Rooks. This is Maine Calling on Maine Public.